providing trauma-informed nursing care in the psychiatric setting. Learning objectives. Define trauma-informed care. Identify experiences that may lead to trauma. Outline a nursing assessment of the traumatized client, including specific, effective interview techniques for eliciting a valid assessment. Understand how internal stimuli can alter a patient's perception and verbalize nursing interventions that are designed specifically for working with clients who experience these. Discuss the problems with leading questions and why open-ended questions result in a more accurate clinical picture. Demonstrate the ability to recognize and formulate an open-ended question. Defining trauma. Trauma is a pervasive problem. It results from exposure to an incident or series of events that are emotionally disturbing or life-threatening with lasting adverse effects on the individual's functioning and mental, physical, social, emotional, and/or spiritual well-being. It is a response to a deeply disturbing event that can render an individual helpless and doesn't just go away. Experiences that may be traumatic include physical, sexual, and emotional abuse, childhood neglect, living with a family member with mental health or substance abuse disorders, sudden unexplained separation from a loved one, poverty, racism, discrimination, and oppression, violence, war, or terrorism in the community. What do we mean by trauma-informed care? Trauma-informed care is an approach that recognizes and responds to the experience of trauma. It acknowledges that trauma is widely experienced and often stigmatized. It helps staff and patients understand how trauma can impact an individual. What is the premise of trauma-informed care? Trauma-informed care provides a safe, secure environment where the patient is supported and able to feel comfortable accessing care. Trauma-informed care shifts the focus from "what's wrong with you" to "what happened to you?" What are some of the effects of trauma? Trauma affects the brain, especially the developing brain. It adversely affects both short-term and long-term well-being and overall functioning. It has been associated with mental disorders, addiction, and other impairments that affect an individual's physical and mental health. It can make it hard for someone to cope with future distress and the ability to form healthy relationships. What are some of the long-term effects of trauma? Trauma has wide-ranging effects: physical, emotional, psychological, and behavioral. Experiencing internal stimuli is a common effect of trauma. All patients deserve health care in a safe environment. Caring for any patient requires awareness on the part of the staff of the actions needed to maintain a safe environment. We must make our patients feel safe. Psychiatric patients must sometimes deal with more than just the external stimuli of the healthcare environment. Sometimes patients deal with intrusive thoughts, delusions, illusions, and hallucinations. These are internal stimuli and can influence the perception of their environment. It's important to understand the differences between these common internal stimuli. Intrusive thoughts, a thought that refuses to go away and interferes with a patient's ability to be present. For example, "I'm going to die, I'm going to die, I'm going to die, I'm going to die." Delusion, a belief that a patient holds as truth despite evidence to the contrary. Example, the patient believes that the staff is an alien sent to Earth to probe life on our planet. An illusion, an incorrect perception of an existing item. An example, the blood pressure cuff is a boa constrictor that eats your arm. A hallucination, perceiving or experiencing something as being real that is not present in the environment. This can involve any of the senses. For example, patient hears command hallucinations to jump out of a window or smells smoke or something rotten. Therapeutic communication tip. When approached by a patient verbalizing a delusion, respond to the feeling, not the delusion. If a patient says, "There's a bear in my room," the patient is feeling fear, so provide a safe environment. Staff could say, "Come sit next to me, you'll be safe here." Trauma can also produce triggers. Triggers remind the trauma survivor of the events that originally harmed them. Triggers can cause someone to essentially relive the traumatic event and become highly distressed. A triggered patient is distressed and may misinterpret events around them. Triggering a patient in an interview is a problem because triggers can interject an answer suggested by past trauma and not current reality. They make it difficult or awkward for the patient to perceive their current situation and instead relive the traumatic event. It is important to not trigger a patient as we interview them. This is called re-traumatizing the patient. A triggered, re-traumatized patient can become suspicious of others, uncooperative, fearful, agitated, or even violent. Staff can sometimes trigger a patient without realizing it. Asking a closed-ended or leading question can trigger a patient. Leading questions presume knowledge about something that isn't known, guide the interview or conversation in the direction intended by the person asking the question, are often unilateral in direction so that, even if they don't indicate the suggested answer, tend to prevent the conversation from going into patient-directed communication, and lead to false or biased answers. An accurate assessment depends on asking questions the correct way. When we ask questions, we want to learn more about the patient's actions. Leading questions are a problem because they interject the answer we suggest in the question itself. They make it difficult or awkward for the participant to express another opinion. Open-ended questions help prevent triggering trauma in patients. What are open-ended questions? Open-ended questions are questions that cannot be answered with a simple yes or no, and instead require the respondent to elaborate on their points. Ask open-ended questions when you want to develop a better understanding of your patient's needs or get more context behind their actions. Open-ended questions direct the interview without putting words into someone's mouth. Examples of open-ended questions. Tell me about your current situation. Can you tell me what happened? How long have you felt this way? Tips for asking open-ended questions. Ask open-ended questions to allow patients to reveal their feelings and their most relevant concerns. Avoid asking why questions because they create tension for patients, as they usually don't know why something happened or why they did something. An alternative to why questions are what questions, such as, what else can you tell me about what happened? Open-ended questions can be probing questions. There are two different methods to asking probing questions. Probing for clarity. If you ask an open-ended question that results in a general answer, ask another open-ended question for clarity. For example, if you ask someone, "What is it about the medications that made you stop taking them?" and they respond, "Because of the side effects," you can ask them additional questions for clarity, such as, "What specific side effects were you having?" Probing for completeness. Once a complete, clear answer has been given to an open-ended question, you can ask more questions to get additional information. Examples of questions that probe for clarity are, "What else do you like about your doctor?" or "What other reasons do you have for wanting to move to Arizona?" And finally, Be sure to listen. Asking the right questions is pointless if you're not listening. Sometimes we are guilty of formulating the next question without paying attention to the answer to the previous one. You miss great opportunities for follow-up questions if you do this. Make an effort to listen to the answer of the question you just asked. Thank you.
Now that you're an expert at providing trauma-informed care, show off your new skills by answering a few questions on the sheet provided.